At Crystal Clinic Plastic Surgeons, much of our practice is devoted to breast reconstruction surgery and helping women choose the procedure that's right for them. Here in our new state-of-the-art hospital, we're focused on enhancing each patient's experience and supporting the healing process. We are proud to offer the latest innovations in breast reconstruction so that our patients can move past their breast cancer diagnosis and not only survive, but thrive. Breast reconstruction is the right of every woman who has had or is planning to have a mastectomy. Despite this, not all women facing a mastectomy are offered breast reconstruction. Through our annual Pink Runway event, held on Breast Reconstruction Awareness Day in October, we've continued to raise awareness about the rights of breast cancer patients as we empower and educate women about their options. We also celebrate the inspiring stories of a few of our breast reconstruction patients who walk the pink runway and show us just how beautiful survival can be.
One of these women is Lynn, a patient of Crystal Clinic Plastic Surgeons who was slated to walk the pink runway in 2021. Although we have postponed Pink Runway due to the pandemic, Lynn has graciously agreed to share her experiences regarding breast cancer and breast reconstruction.
I was diagnosed in September of 2017. My breast cancer was found in an annual mammogram. And based on my particular diagnosis, it was recommended that I have a double mastectomy. Because when you're told you're going to have a double mastectomy, your initial thought is, what am I going to look like after? What are my options? Do I have options? So talking with Crystal Clinic Plastic Surgeons was extremely helpful, because based on what I explained to them, what my lifestyle is, what my activity level is, they were able to suggest an option for me, which was an advanced plastic surgery reconstructive option. I just wanted to be put back together again, and that's exactly what Crystal Clinic did. I wanted to have a natural look and feel. I wanted to be comfortable. I wanted to feel like myself. And they literally put me back together and gave me my life back so that I can continue on doing the things that I normally would do before my diagnosis. My surgeon is beyond fantastic. He was listening to me all along the way throughout my process. From the first time I met with him and explained to him what I was looking for my life after reconstruction, he understood it completely. He explained everything thoroughly, and he made me feel very comfortable about my choices, and I had nothing but confidence in my surgeon moving forward. He's a great human being. He's very patient and kind, and he met me where I was at throughout my process. I talk to patients all over the country, all different ages, that have a similar diagnosis and similar protocol to me, and try and help them work through their decisions on what types of reconstructive surgery they should have, what are their options, what's best for them. Every woman chooses something different based on a lot of different variables: age, family, lifestyle, what their family thinks they can do. There's not a one-size-fits-all choice for every woman. It's a very personal decision, and women make decisions that's right for their specific need. What I think women need to know about Crystal Clinic Plastic Surgeons, the first thing is that they have options, and that they need to discuss those options with their plastic surgeons at Crystal Clinic. You want to be comfortable with your surgeon. You want to be confident in your surgeon. But they are all very kind, very compassionate, very flexible, and they want to do what's best for the patient. I think you can feel comfortable knowing that they're going to take care of you and that you're going to make the best decisions possible for you. I'm very happy with the choice, and I'm very thankful that my surgeon was patient and respected my wishes to wait and work with me till I was physically and emotionally ready to continue. And so that's what we did together. And he's outstanding. I can't say enough kind things. He literally put me back together.
Like Lynn, many of our patients choose to undergo advanced breast reconstruction using their own tissue. The deep flap reconstruction, which uses a patient's own abdominal skin and fat, is considered the gold standard for breast reconstruction. Only 3% of plastic surgeons in the country perform this procedure, so we are among an elite group of plastic surgeons who are skilled in this technique. With the deep flap reconstruction, excess skin and fat from below the belly button is transplanted to the chest to reconstruct a natural, soft breast following mastectomy. The contour of the abdomen is also improved, much like a tummy tuck. The deep flap procedure is a great option for those who enjoy an active lifestyle. It preserves the abdominal muscles so patients have less pain and maintain their core strength long term. Compared to breast reconstruction with implants, the deep flap procedure takes longer to perform and involves a longer hospital stay as well as a slightly longer recovery time, but has a low complication rate and avoids the long-term maintenance associated with breast implants. For patients who are not a candidate for a deep flap procedure, there are other innovative microsurgical techniques available. Our comprehensive breast reconstruction center also specializes in advanced lymphedema surgery.
Traditionally, in breast cancer treatment, patients can either undergo a mastectomy with reconstruction or a lumpectomy with radiation therapy, also known as breast conservation therapy. Whereas a mastectomy removes the entire breast, a lumpectomy removes only the cancerous tumor, allowing the woman to keep her breast. Many women opt for lumpectomy and radiation, but don't always get their desired aesthetic results. With oncoplastic surgery, we try to avoid this outcome. Oncoplasty, a relatively new, multidisciplinary approach that combines cancer surgery with the principles of plastic surgery. Before the procedure, as a team, the breast and the plastic surgeon work together to design an operative plan. After the cancer is removed, the shape of the breast is restored through either a volume-reducing or enhancing approach. One of the biggest advantages of this surgery is that it allows the cancer surgeon to remove a larger area around the tumor, which in the past may have caused a significant deformity. Depending on the size of the breast, oncoplastic surgery can either add or reduce tissue in the breasts. For example, some women with very large breasts may suffer from neck, back, and shoulder pain before their cancer diagnosis. This is called symptomatic macromastia. Breast cancer surgery through a reductive oncoplastic approach not only removes the cancer, but also reconstructs both breasts, lifting them up on the chest, making a smaller, improved shape. Preoperative discomfort is relieved, greatly improving the patient's overall quality of life. Additionally, the new shape makes radiation therapy easier and more effective. Oncoplasty also makes breast conservative therapy available for some small-breasted women. If a tumor is removed from an area of a smaller breast where there's not a lot of tissue, volume needs to be restored. This may be accomplished through local tissue rearrangement using flaps or with fat grafting. With fat grafting, liposuction is performed and the collected fat cells are transferred to the breast to correct the deformity. This surgery may be performed at the time of partial mastectomy or after radiation. It is important to note that oncoplasty is covered by insurance. This includes breast reconstruction, oncoplastic procedures, and the management of the opposite breast for the purpose of symmetry.
Another form of breast reconstruction involves saline or silicone-filled implants. The latest silicone implants provide a more natural shape and feel, along with excellent aesthetic results. This approach has traditionally been performed in phases with the tissue expander placed under the chest muscle. The expander allows the tissue to heal and soften as the pocket expands to the desired breast size. We now almost exclusively perform a single-stage direct-to-implant breast reconstruction with an implant placed above the chest muscle and in conjunction with acellular dermal matrix made from the collagen layer of skin. This results in less pain and a faster recovery. There are many advantages to implant-based reconstruction. It's a shorter and less complex surgery, doesn't create new scars, and it has a quick recovery. It's also an excellent way to correct unsatisfactory results from a previous surgery. Regardless of which breast reconstruction technique you choose, it's important to do your homework, to learn more about your options and the expertise of your surgeon. We're always available to discuss these options to help you determine the one that's best for you. Throughout the month of October, please follow Crystal Clinic Plastic Surgeons on Facebook and Instagram to learn more about the inspiring women who will return to the pink runway in 2022.